What happens inside the body when bleeding after childbirth becomes dangerously heavy? This is postpartum hemorrhage, and knowing the warning signs can save a life. What is postpartum hemorrhage? Postpartum hemorrhage, or PPH, is excessive bleeding after childbirth. It can happen shortly after delivery and requires rapid medical attention. Normally, after the placenta separates, the uterus contracts. These contractions help compress the blood vessels where the placenta was attached and reduce bleeding. But sometimes the uterus does not contract properly. This is called uterine atony, and it is the most common cause of postpartum hemorrhage. Healthcare professionals often remember the major causes using the 4Ts: tone, tissue, trauma, and thrombin. Tone refers to uterine atony, when the uterus remains too relaxed after delivery and cannot effectively compress the blood vessels. Tissue refers to placental tissue that remains inside the uterus and prevents the uterus from contracting normally. Trauma refers to injuries of the birth canal, cervix, vagina, or surrounding tissues that can cause significant bleeding. Thrombin refers to problems with blood clotting. When the body's clotting system isn't working properly, bleeding can become difficult to control. Warning signs can include heavy or increasing bleeding, dizziness, weakness, a rapid heartbeat, low blood pressure, or feeling faint. Severe postpartum bleeding can cause shock and become life-threatening very quickly. This is why immediate medical assessment and treatment are essential. Treatment depends on the cause and may include uterine massage, medicines that help the uterus contract, removing retained tissue, repairing injuries, fluids, blood products, or other emergency procedures. The key message is simple: heavy bleeding after childbirth should never be ignored. Postpartum hemorrhage is treatable, but getting medical help quickly can make a critical difference. Postpartum hemorrhage. What happens inside? Postpartum hemorrhage, PPH, is excessive bleeding after childbirth and is a medical emergency. If someone has heavy or worsening bleeding after giving birth, they need urgent medical attention. Microphone # important accuracy note. Definitions of PPH vary by guideline. For example, WHO commonly uses greater than or equal to 500 milliliters of blood loss within 24 hours after birth, while some clinical guidelines use greater than or equal to 1,000 milliliters or blood loss accompanied by signs of hypovolemia. So for a public educational video, it's safest to emphasize heavy or increasing bleeding and urgent medical assessment rather than presenting one number as the only definition. Did you find this video helpful? Don't forget to like this video, leave a comment with your thoughts or questions, and subscribe to the channel for more simple and informative medical education videos. Turn on the notification bell so you don't miss our next video. Thanks for